And tonight, some describe the overturning of Roe v. Wade as a gut punch. Some believe the ruling will disproportionately impact black women. 10 TV's Richard Solomon has more from a local doctor on why this could be a risk to so many black women.
Well, AC, this is data from the Ohio Department of Health. It reports black women make up nearly half of the women in the state of Ohio who got an abortion. And this is exactly why some women believe that their right to have an abortion has been taken away.
This overturning of Roe v. Wade is not somebody else's issue. It literally is going to be our issue. We need to find a way to own ourselves back.
Fran Frazier describes the Supreme Court's ruling to overturn Roe v. Wade as a threat to the health of many black women.
I doubt if black women actually feel they actually own their bodies, even now.
Frazier is the founder of Black Girl Rising, an organization that works to elevate the experience in young black girls' lives. Her fear comes after the Supreme Court stripped away the nation's constitutional protections for abortion.
Black women have a much elevated risk of dying in birth as compared to white women.
Dr. Allison Norris is an associate professor in the College of Medicine and the College of Public Health at The Ohio State University. She's also co-principal investigator of the Ohio Policy Elevation Network.
Any person having to go through a birth that isn't one that they wanted and facing the extra burdens around death, it heaps harm upon harm for our Black and brown Ohioans and the people across the country.
Frazier says now is the time for black families to start having candid conversations about sex education and reproductive health care.
This is not a black women, black girls conversation. It has got to be a balanced conversation, and we all have to be held responsible.
And Frazier tells me this is the time when those hard conversations need to be had. And she says, most importantly, men need to be a part of that conversation.